to my my colleague Zahid now, who's going to introduce the next session. And over to Zahid.
Fantastic. Thank you so much. And thank you, Yasmin, for an amazing job moderating that last session. It's a very important subject. And we have other important subjects to talk about in this next session. Really, really excited to have Dr. Seema Yasmin joining us from California. She'll be in conversation with one of the members of our Concordia Forum network and an amazing individual in her own right, Dr. Zainab Kabba from the Skoll Centre for Social Entrepreneurship. I'm going to hand it over to Zainab to begin the conversation. There's a lot to discuss because it's not just a book that Dr. Yasmin has written, but also obviously everything going on with COVID-19, not just the issue of the disease itself, but the information and infodemic, if you will, around misconceptions and misinformation around it. So over to Zainab.
Thank you, Zahid and Mudassir. Assalamu alaikum, everyone. Good evening for everybody in the UK. I think coming off of that last session, it's going to be really great. I'm really happy to be in conversation with Dr. Yasmin. I think from one transatlantic person to another, I think it will also be quite a great conversation. I'll start off by introducing Dr. Seema Yasmin. As I mentioned, she is from England, currently now residing in California. She's a medical doctor, an Emmy award-winning journalist, and author, and is based at Stanford University as a clinical assistant professor and director of the Health Communication Initiative. Just a bit about me, Zainab Kabba. I'm the inverse of Dr. Yasmin, from New York City, and now based in England. My background and research is in educational program, particularly looking at Muslim communities with attention placed on the construction of religious authority. And I'm currently based at the University of Oxford, and my work focuses on developing educational program for MBA students and overseeing research activities related to systems change. So I think coming off of the tail of that conversation, I think there's a lot of crossover in terms of what is going on or we're faced. I think really the work that you've been doing, Dr. Yasmin, lies at the intersection of quite a lot of these issues. But I want to start off by just maybe you telling us a bit more about, your formative years in England and, kind of what led you then to be in the United States.
Okay, Assalamu alaikum, and Dr. Kabba, thank you so much for being in conversation with me. It's a real privilege. I'm very respectful and really appreciate your scholarship. And assalamu alaikum to everybody. It's 11 o'clock in the morning in California, but I know it's evening time for many of you, and I have family and others joining from the UK as well. So it's nice to be in community with you at a very turbulent, difficult time. Not like any of these issues are new. Police brutality, white supremacy, these are century-long issues. Pandemics are not new. We have had pandemics since humanity has been around, but it really feels like a generation-defining moment at the time. Both a pandemic of disease occurring and at the same time these protests across the country and around the world protesting police brutality and anti-Black racism specifically. So I'm happy that we'll get to talk about that. To directly answer your question, I'm a Gujarati Muslim, Sunni, raised in an immigrant family in the Midlands in the UK. That tiny town, Nuneaton, remains the center of my universe, even though I live in sunny California now. I was raised in a very devout community that had quite a narrow worldview on Islam and what Muslims are, who Muslims are, what Muslims look like, something that we have to continue challenging to really appreciate the breadth of the Ummah and the diversity within the Ummah, I think. My family gave me a really good grounding, though, I think, in Islam, in religious studies, and I'm very, very grateful for that. Lots of life experiences I had after that challenged it, right? You think your family's normal until you go to university and you're like, wait, what? There are Muslims who do this and that. So that was eye-opening for me. Islam and being a Muslim is very central to my identity. Building community with other Muslims from different communities is really important to me. And I do want to show you my new book, Muslim Women Are Everything, which comes out in the UK in a couple of days, I think June 11th. And this kind of like, this is me. This is my love letter to the Ummah, especially to Muslim women. This is my wake-up call for the rest of the world that, hey, Muslim women are everything. You know, we are astronauts, we are Olympians, we are authors, we are choreographers, we are poets, and you can't try and confine us and put us into these narrow boxes because we are all of the things. So yes, I very much had that grounding in a particular kind of Islam, in this Sunni Hanafi tradition, which I write about in the introduction to this book. But my worldview has expanded, and I hope continues to expand as I live in different places, as I meet many more Muslims. And I really hope that through this book, it expands that perception of what Islam means, what it means to be a Muslim woman in the world today. And very relevant to the previous conversations, how many panels have I been invited to, specifically as a journalist, to talk about Islamophobia, to talk about Muslim issues, where everyone on the panel looks like me. Everyone is either Indian or Bangladeshi or Pakistani, or they're from the Middle East, and there are no Black Muslims on the panel. There are no Black women Muslims. And I'm tired of that. It doesn't speak to the truth of the Ummah. And so one of the things I like is, as I've been promoting this book, even on Twitter, people will respond and message me and say, are there Black women in this book? And I think, oh, yes, there are. But the fact that you even have to ask me that question speaks to the constant erasure of Black Muslims in general and Black Muslim women very specifically.
Thank you. Thanks for that kind of like initial background. And I really do want us to kind of get to talk a bit more about the book a bit later on. But I want us to kind of hear a bit more about that journey to even writing the book, and this journey through from, you know, this background that you're talking about that you had in the UK, and what that then what then led you to the US. And then in many ways, you know, what are the different elements as you were looking at women from your community and the women that you encountered? What are the things that were a signal to you, either from across Atlantic, you know, transatlantic perspective, but also just in terms of maybe in terms of the work and the sector that you've been in?
Yeah, so, and I can't answer that question without talking about my mother, because she had me when she was very young. She had an arranged marriage, as is still the tradition in my family. And she made a very brave decision when I was very young to leave the community, to leave a marriage that was not a good marriage. And the way my mum left was not just to leave, but to leave specifically to go to university and to take me with her. So I used to live in a university dorm with her, where everyone else was 18, kind of your average student. And then there was my mum, who was like 25. I was about 5, and she had been a housewife. That's what she knew. But she understood that to break this cycle, to make sure that I had bigger opportunities than she had had, that she needed to get an education, and that would help me get an education. And so that really immersed me in this academic environment. I love campuses. I still do. They're like my favorite places. And specifically libraries on university campuses, I could live in one. My friends make fun of me for how often I am in the Stanford University library. It's beautiful, but that was really formative experience for me. And then I didn't spend all that time with my mom, because I would live with her for a year. Then I'd go back to the Midlands, to my very conservative, very religious family. So I was doing this back and forth. And that really informed me too, that there are different ways of practicing your religion. There are different ways of being a woman in the world. And I think I walk with that combination inside me, and it does unfortunately lend itself to lots of cognitive dissonance too. But I think there are so many of us that deal with that, right? We are one way with our family, and we love them and we respect them, but we have to speak a different language when we are in academia, when we are on CNN, as I am very often, right? I'm an analyst for CNN. I write for the New York Times, Rolling Stone magazine. We have all of these different personas, and we bring out different parts of us, I think, for different audiences. And that's a beautiful thing, because we contain multitudes. And sometimes it's also a really difficult thing to grapple with. My journey to the US from Nuneaton was, I did my undergrad in London. Didn't think I wanted to be a doctor. There weren't any doctors in my family, but I was very interested in HIV. My mum became an AIDS activist. She was a caseworker for North African and Middle Eastern people living with HIV. And so when I was a teenager, I got to see how this microscopic virus stigmatized people. how people could be infected with a thing that you could not see, and it completely changed their lives. And what I saw was that it wasn't just medical. The things that my mum would deal with her, the people that she helped, it wasn't just trying to get them on medication. It was dealing with their housing. It was making sure they had food to eat. It was making sure that their immigration was sorted out. And so this microscopic virus exacerbated all of those existing inequalities. And so I'm frustrated even now, you know, in the current pandemic, people are like, oh, it's shining a light on all the injustices. And I'm like, it is. But some of us, many of us have been shouting for decades about these injustices. Why did it take a global health crisis for people to realize that in America, the healthcare system is broken, that in the UK, many systems are broken, right? So these have been existing problems. And yes, viruses come along and they just exacerbate what's already broken. So anyway, I went to university, studied biochemistry, met a physician from Amsterdam called Dr. Joep Langer, who just had faith in me and believed that I could be a doctor. And the thing that he said to me before my undergrad was that it's all well and good if you want to be a scientist and you want to develop HIV vaccines or HIV medicines, as I did. But he said to me, if you really want to make a difference with HIV, make a difference in the world, you need to learn how to take care of people first. You should go to medical school. Like if you want to work in a lab, that's all good, but you need to know what the suffering that somebody with HIV might go through. You need to know what their day-to-day life is. So I took his advice and I went to medical school. I went to Cambridge. I didn't get into Oxford. We can talk about that another time.
I forgive you, it's all right.
So I did medicine at Cambridge, and then I wanted to go back to East London, which is where I'd spent my teenage years with my mum after being in the Midlands. So I grew up a lot in Hackney, my teenage years, my formative years. And I thought, okay, after 4 years of being in this surreal bubble that is Cambridge with all of the Hermiones and Sebastians, and like, it was intense. I was like, this is a great training. Thank you so much. But I have to get back to the real world. And so I did my training then at Homerton Hospital in East London. And, you know, like I live in America now. And so you really learn to appreciate the NHS when you are no longer in it. And it is flawed. I will tell you, because I worked in it. We know it's flawed. But oof, when you live in a country where you have to have health insurance and a credit card to get care, you really appreciate the National Health Service.
I think I don't think I've been to the hospital as much as I have in the last, 2 years that I have in my entire life living in the US. So, and yeah, I agree. It's that safety net, I think, is, comforting to know that you can get access to healthcare, even though, as you said, the system is in a challenging situation.
Yeah, and a Tory government is very deliberately breaking it apart. There's another conversation too. But anyway, I went back to East London. I went back to Homerton, and I love clinical medicine. I love how useful you can be to somebody. I love that you can do things in a moment that can alleviate someone's suffering, even a little bit. It's very gratifying. But it was also really frustrating, Professor Kabba, because we weren't dealing with the root causes of what brought somebody into A&E, right? And I remember metaphorically getting my hand slapped because I'd be on the phone for ages trying to get somebody housing because they were homeless. And I was told, you're not a social worker, you're a doctor, get back into A&E and go see patients. And I was like, but I don't get it. This person, we just drained their abscess, it was infected. We now need them to take antibiotics, which I have in a bag. But I know that they sleep on a park bench because I walk past them on my walk home. And I used to see that all the time. People I'd recognize from A&E, literally on the streets. I'm like, where are they going to put the antibiotics? I told them to take the pills with food. What food? Like, this doesn't make sense to me. And there's an amazing physician here in the US called Dr. Lynn Paxton. And she said to me, you're interested in public health. You're interested in the root causes of illness and the social determinants of health. You need to train in public health. And so I moved to America on her advice because I had applied to join something here called the Epidemic Intelligence Service. And it's a service that's housed within the Centers for Disease Control in Atlanta. But it's a specific group of physicians who are trained to deal with the disease, outbreaks of disease. So colloquially, Epidemic Intelligence Service officers, as I was, are known as disease detectives. So you get dispatched into the hot zone when Ebola happens, when whatever kind of outbreak happens. And you realize really early on that there are outbreaks all the time. And
So
it
a lot of
was,
your time was spent, a lot of your time during that period was spent with the Navajo Nation. Is that correct?
that's right. So I happen to be stationed in the Southwest. And so you're primarily responsible for outbreaks in your vicinity, although I got sent to Kenya and other places too. But what you realize with the American Southwest is that there are so many sovereign nations there. There's Navajo Nation, there's Hopi Nation, there's White Mountain Apache tribe, there's San Carlos Apache tribe. And because of the history of genocide of Native people in America, lots of American Indian people live on these reservations, which were the only land that they were given. Often it's terrible land. It's not the fertile land that their people originally lived on. And there's immense poverty, very high rates of diabetes. And that's historical too, because the US troops that herded those people onto reservations gave them rations that were historically very, very unhealthy. And this is relevant now because the Navajo Nation, of course, has seen the highest per capita rates of COVID-19 than anywhere else in America. And so we have to talk about why is that? And unfortunately, and especially with the disparities in Black Americans too, Black Americans are 2 to 7 times more likely to die from COVID-19 than white Americans. What often happens is this conversation about personal behavior. Well, they should exercise more. Oh my God, do you know how high the rates of hypertension are among Black Americans? They need to eat less salt. And it's like, no. If you know anything about public health, and if you don't, I'm happy to teach you Public Health 101. Your genes are responsible for like this much of your well-being, your environment, your education, whether there's a library near you. Those things are much more significant in terms of contributing to your health. So I got to see
with this idea of you know, what this professor said to you about learning how to care for people, and what you said you took away from medical school. I think, you know, I'd be curious to hear, kind of going and thinking about your work in journalism. How do you see yourself caring for people at this intersection of both journalism and then looking at what's happening with COVID?
So actually, that whole thing, that whole aha moment I had about going from being a disease detective to being a journalist happened on the Navajo Nation. Actually, I'll tell you in a nutshell. I got sent to investigate an epidemic of flesh-eating bacteria on the Navajo Nation caused by a bacteria that if you get it, it can just cause a very mild rash. But in some people, again, we can get into what those root causes are, it can cause death. It can cause amputation of your limbs. It can cause sepsis. So anyway, I go on to the Navajo Nation with a team, and I'm going door to door, as you do early in an epidemic investigation, to try and find more people who are infected, to warn people. And this young mother opens the door one morning, and she has these kids running around her ankles. And I say to her, does anyone in your household have any of these symptoms, a rash like this, such and such? And she says, no, but I am so worried about this epidemic. Like, I know somebody who died. How do I keep my children safe? And me, with all of my hubris, because it was really hard to investigate the epidemic, it was very hard for me at the time to find the patient zero. But I was like, oh, this question's easy. I can answer this question. And I was like, oh, all you have to do is, while this epidemic is raging and we're still trying to get it under control, just make sure you wash your hands thoroughly throughout the day. Make sure your kids wash their hands, you know, and then you'll be fine. And she was like, wash my hands with what water? And I was like, what? And I'm a very professional person, but my jaw dropped so much that the Navajo translators and the Navajo health workers who were with me were like, your jaw was on the floor. Because I was like, oh, you don't have running water. That's why your people are dying. That's why your people are dying. You could, if you had soap and clean water, you wouldn't be ending up in the ICU. Your arms wouldn't be getting cut off. You wouldn't be dying from this bacteria if you had clean running water. And mind you, to get to the Navajo Nation, I'd driven about 5 hours from Phoenix, Arizona, past beautiful malls, past big houses. In that 5 hours, I'd ended up in a place where people did not have running water and people were dying because of it. And I thought to myself, wait, did I just not know this? Because I was new to America at the time. I'd only been there for a few months. I was like, do people not know this? Or do people know and they just don't care? right? And so I thought, it's all well and good being a public health physician. I went from being like a hospital doctor, wanting to have a bigger impact, so therefore going into public health, where my patients are now not individuals, but communities, whole populations. But I was like, this isn't good enough if we're not raising awareness about the root causes of illness, if we're not raising awareness about the fact that people are dying because they don't have running water. And I thought, what can I do to change that? How can I leverage my expertise and my experience in a way that makes people aware and concerned and do something? And I thought, it's going to have to be journalism. So then I went to journalism school. And
so is the journalism the
way,
solution to that care that you are in some ways providing at this point?
Absolutely, because one of the things that frustrates me about medicine is this divide between the medical profession and the rest of the world. Like we are doctors, we trained, you know, we went to Cambridge, we know our stuff. Like, we're going to tell you what to do and you're going to do it because we have power. And yes, doctors, healthcare providers have immense power over the bodies and the lives of people, but how dare you not educate people? How dare you not let people make informed decisions about their health? Whatever complicated thing you do in neuroscience, immunology, whatever it is, you know that Einstein saying that if you can't explain that to somebody else, like in plain English, then you don't understand it. So like, yeah, get rid of that hubris, bring people in on the conversation. And what we're seeing now with the pandemic is the manifestation of that divide, because people are less and less trusting of medical professionals. People are believing the misinformation and the disinformation, and people are not being engaged on a community level about contact tracing, about vaccine research. And that disconnect between we're public health, we're the medical establishment, and the communities affected by disease, that's really bad for public health. You have to have engagement of a community in order to protect people's lives.
So how would you say, I mean, you know, on this topic of disinformation and misinformation, I think what we're seeing, you know, and you know, we were seeing a lot of that with COVID when it first arose. Now, I think with everything going on with the protests across the US with the murder of George Floyd, there's a lot of intersection of that in terms of that misinformation, as well as what COVID is doing, the high rates of death in Black communities. How do we begin to deal with misinformation and disinformation at this intersection where we are, you know, certain communities are being affected more so than others, as well as just the conversation around, you know, this health pandemic, as well as the racial one?
So this is what I study at Stanford, and it's what I try to mitigate through education and other interventions at Stanford. As director of the Stanford Health Communication Initiative, we track not just disease spread, but the spread of misinformation and disinformation about disease. And I'll answer your question, but I have a lot more to say about this in a book that's coming out in a few months called Viral BS, Medical Myths and Why We Fall for Them. And I make a few points. It's very relevant. I started writing this, of course, years before. You know, the process of writing a book takes a long time. Just so happens to be coming out, right? So within public health, I've been very frustrated that when I would get sent to investigate an epidemic, for example, my sole focus would be on the pathogen, stop the disease spreading. But what I saw over and over again was that the disease did not spread in isolation. Yes, there was a virus that was contagious, but person to person, but there were rumors, there were medical myths, there were health hoaxes. And what you see is those communities who are most vulnerable to disease spread also happen to be the communities that are most vulnerable to misinformation and disinformation. So many people watching may have heard of the term medical desert or health desert. There are different definitions, but just loosely speaking, a medical desert is where you have a population that lives perhaps 60 miles or more from an acute care facility. So when we talk about medical deserts, we're talking about people that don't have good access to healthcare. It's far away, it's expensive. But then you also have news deserts, people that live in places that don't have robust local journalism, people that live in places where their news organizations locally have been decimated. The New York Times can't report on every small community, but when you have solid local journalists, they will go to a 6-hour city council meeting for you, and they will hold accountable the leaders who are doing strange things with your tax money, right? So we need journalism, but you end up with news deserts, people that don't have access to that kind of good, robust accountability journalism. And often those same people live in medical deserts too. So they are doubly impacted by the spread of disease and the spread of misinformation and disinformation about disease. And I will just quickly say, I give lots of talks on this, but in a nutshell, misinformation is false news that is spread with no intent to cause harm. It can be the myth, the rumor that somebody's trying to help you, but it's not true. Disinformation is false. It's also false, but it's spread with the deliberate intent to cause harm. So this might be disinformation campaigns where there's an internet research agency in Russia that oftentimes creates a hoax of the CNN website and puts fake news on it, or false news. I try not to use the term fake news, to cause alarm, to cause confusion. But yes, there are certain communities that are more affected. And I became very interested in this because it's another area of inequality. And so we study that here and we try and develop interventions. One of the things I write about in the book Viral BS is that science and medicine have a very racist, very sordid, very unethical history. And it's not old history, it's very recent history. You think about the Tuskegee study where Black men in Alabama were left untreated with syphilis, left to suffer, pass it on to their kids. Even once we knew that penicillin could cure syphilis, that ended in 1972. That's not long ago. There are people who are still alive who remember that. They don't trust doctors. They don't go to doctors. You know, not far from Tuskegee, there was a really bad outbreak of TB a couple of years ago. And a lot of my colleagues in public health were like, oh, why aren't the people there going to get health care? And I'm like, it's an hour away from Tuskegee. Like, why would you trust a doctor after people that you know were exposed to government doctors from the CDC where I used to work who lied to them? And so and it continues now. There was a study that came out about 4 years ago from the University of Virginia, where the researchers interviewed medical students and doctors, and they found that these white medical students and doctors held magical beliefs about Black people. These are so-called scientists, right? People trained in science. They believe that Black people have thicker skin. They believe that Black people's blood clots differently. They believe that Black people feel pain differently. This manifests with Black people being ignored in A&E or in the ER. It manifests, and this has been studied too, with the withholding of medicine. And the reason I bring this up, people don't like talking about horrible history, but unless we atone for that, unless we admit and acknowledge it, we're going to keep having communities who do not trust the medical establishment and the scientific establishment, because honestly, why would they?
Right, of course. I want to ask one last question before we kind of, I'm just moving on to talk about the book. I'm conscious of time. How, you know, with the protest now, and we are still in a pandemic, how have you seen the protests change the landscape beyond the issues of social distancing as it relates to the COVID pandemic?
So Lawrence Wright, who was on an hour or so ago, is a friend of mine, and I read an early draft of his new book because I'm an expert in epidemics. But I disagree with what he said earlier, on this forum about disconnecting the pandemic on one hand and protests on the other. Those issues of police brutality and anti-Black racism are completely connected to the pandemic. Larry, how can you try and disconnect them? And for anyone who's outraged about people are protesting while there's a pandemic, well, yeah, you're not understanding that this country and many countries were never safe for Black people. And they'll continue to be unsafe unless we undo white supremacy. So it's all fine saying we should just stay indoors. We shouldn't be out congregating. It's a matter of life and death. It's a matter of survival. It's not the same as, my uncle being a little bit upset that he can't pray Jummah in the masjid. You can pray at home, and he understands that Islam says there are times when it's safe, when it's safer, that you must protect your health and your community's health. Protesting is different to that. It's fighting a systemic inequality that is literally killing people. And so our responsibility is to fight both the pandemic and that injustice.
Do you think that in terms of, I think there's a recognition of how in which Black people have always felt unsafe in that regard. Do you think that there, in terms of the amount of white people that we are seeing at the protests, do you think that that same principle holds in regards to feeling like, well, it never was safe? How would you say that in some ways that explain the ways in which those people are choosing not to socially distance knowing there's a pandemic?
I would say that there are many people who are doing protesting across the states who are doing it in a way that allows them to actually be physically distanced from others. And sometimes those images don't make the news as much, but I have seen many of those images and talked to reporters who are my friends and former colleagues who are reporting from places. They send me pictures of people wearing masks, wearing goggles and gloves, and then actually sitting down in protest and being about 6 feet or 2 meters away from others. What we're also seeing, though, is policing practices like kettling, where the police herd people like cattle into fenced off areas. You can't physically distance if a police officer is doing that. So I think we also have to talk about policing practices, also the use of tear gas, you know, which is known to cause respiratory illness. It's been studied in military troops because they're often exposed to it before they go into combat so that they can acclimatize and know what to expect. And we've seen that that's in young, healthy, often majority male groups, that they can suffer chronic bronchitis. So we have to think about those weapons of war that are being used during a pandemic. You know, tear gas being deployed, it literally makes people cough, which sheds virus and transmits the disease a lot more. But I will say it's interesting seeing how diverse the protesting groups are. There's so many white people. I hear from colleagues in Boise, Idaho, who send me images and video of people, majority white groups. And they say to me, Seema, people here don't protest. And they certainly don't protest anti-Black racism and police brutality. So something's shifting. And also you may have seen about 110 or 120 cases, at least publicized cases of journalists, many of them white, who've been attacked by police while they were covering protests, including one journalist who's been permanently blinded in her left eye. So I hope that people are realizing that actually white supremacy upholds power for a minority of white people, that white supremacy perpetuates systems that are bad for the health of many people, not just Black people, but it's especially deadly, of course, for Black people.
Okay, so kind of switching gears a bit, you know, let's talk a bit about your new book that is out, Muslim Women Are Everything. I guess my first question is, you know, do Muslim women need to be everything? You know, what does that phrase mean for you, and why that title of the book?
So no, we don't have to do anything. We don't have to be anything. You're a woman, you get to decide what you want to be. I came up with this title one day when I was working on the introduction, and it just struck me that people try and confine us and say, you are this thing, or I think Muslim women are housewives, or I think professional Muslim women are mostly doctors. And I'm like, no, we can do much more than that. Some of us are doctors and we are also journalists and authors. Some of us are astronauts. Some of us are entrepreneurs. So I don't mean this to put any pressure on Muslim women. In fact, quite the opposite. And the way that the book started off speaks to exactly your question, actually, because this whole book started off as an angry tweet from me a couple of years ago. And I was just really frustrated at the way that corporations, the big corporations, were supposedly celebrating Muslim women, maybe women like Ibtihaj Muhammad, you know, an Olympian. And as they were celebrating us, they were kind of really surprised, and they were kind of telling on themselves in the language they use to celebrate us. I'm a journalist. I really pay attention to grammar and syntax, and you can tell by the way people phrase things what they're really thinking, and they often tell on themselves. So they were pretending, or they were kind of purporting to celebrate some high-profile Muslim women, but really they were like, oh my God, can you believe Muslim women in hijab go to the Olympics? Muslim women run businesses. And I was like, yeah, what do you think we are? Like, what do you think we do? So I tweeted something along the lines of like, yes, Muslim women do things. Like, what is the, you know, celebrate us properly. And an editor saw the tweet and said, can you write an essay based on this? And I said, no, because I didn't want to write another, we're just like you, we're just women, we bleed just like you kind of essay. I was like, I'm not doing that kind of proving my humanity to you, you know? We shouldn't have to do that. You know, Suhaima Mansour Khan, a British poet and activist, is in here, and she went viral with her poem, which was ended with something along the lines of, if I have to prove my humanity to you, which one of us lacks humanity? So I wasn't gonna do that. But I also wasn't going to turn down the opportunity to be published and have a platform. So I ended up writing a kind of prose poem that was called, Yes, Muslim Women Do Things. And it was about Muslim women doing amazing things like taking a nap, reading a book, digging lettuce out from between our teeth, right? So it was very my brand of humor, which is like, what do you think we do? We take naps and we read books. And some of us are surgeons and some of us are really lazy. But guess what? That's what being a Muslim woman means. It means you can be very driven. It might mean you're very lazy. It might mean you're an activist. It might mean you're like, oh God, I don't get into politics at all. Whatever, right? You can still be a Muslim woman. So that essay went viral and it led to this book. Go ahead.
Okay, and your choice of the women in the book, you know, the introduction very much kind of talked about your background, some of the things you mentioned earlier regarding your mother, and other women that you were around at the time during those formative years in England. Can you talk a bit about your choice to choose women that were quite well known and popular, perhaps like in contrary to the women that you grew up with who don't necessarily have that kind of like notoriety or celebrity?
And I would say though that we see ourselves in other women too. We see elements of ourselves, which is why it's so empowering to have a book that's full of us, because you recognize yourself in other women's stories. And so I think like with my mum, she doesn't wear hijab, she prays 5 times a day. You know, Islam is central to her identity and her lived experience. And she raised me, but also my auntie raised me, and my auntie's worn niqab her whole adult life. My auntie is very devout. And they were both my mothers, and I learned so much from both of them. In fact, the place that I like to do everything, like a journalist, I'm a poet, I'm writing a novel, I'm also a doctor, I'm a professor. I get that from my auntie, who didn't have schooling beyond the age of 16, I don't think, but she can do everything. My auntie is a polyglot. She's such a great reader. She's so funny. She can cook anything. You can show her a dress in Topshop and she'll look at the seams and go home and just make it. So I was definitely inspired by women like that who were, you know, my aunt was divorced and she single-handedly raised her own 3 children, but me as well for many years. So to me, I needed to see women like that represented in this book. And that's why, yes, Ibtihaj Muhammad is in this book. So is Malala Yousafzai. There are names that you will recognize, Nadia Hassan and other people. But there's also a scuba diving midwife from Indonesia. There's also a Tunisian French stand-up comic who you may not have heard of, right? But I want you to hear of them because these women are hilarious. They are such go-getters. They are full of contradictions, as we all are. One of the things that was really painful about the book publishing process was that after publishers saw the essay go viral, some of them wanted to publish the book, but publishing is very white and it's not infiltrated by many Muslims at all. And there's a lack of understanding about us. And so there were people who saw the proposal and were like, I don't think there's a market for this book. And I'm like, really? Did you know there's like 1.8 billion of us and about half of like women, like whatever, like again, people really telling on themselves that there is a market. You don't think we're interesting. Or there was a publisher that said, oh, there's already a book about Muslim women. Did you say that out loud? But some of the feedback we'd get that was back and forth was people saying, oh, you need to have more high profile women in there. And I'm happy to celebrate the diversity of us because some of us are celebs, some of us are not. We're all amazing. But then for example, in the proposal, I'd add Malala Yousafzai, and then another publisher would say, oh, she's overexposed. You need to take her out. And I was like, I cannot win with you people. Like, stop trying to make us one thing when we are all of the things. And thankfully, I have an amazing agent. So even when I was like, oh my gosh, it's not just difficult getting rejected, but it's extra difficult because of the way it's getting rejected. I was like, let's just move on. And my agent was not having it. She persisted. And then we ended up with this incredible deal with HarperCollins, I think mostly because the acquiring editor was a young Latina and she got it. She saw the book and she was like, this book needs to be in the world. And so, you know, when we say representation matters, that's why it matters, because having a young Latina at the table with money, with control over HarperCollins acquisitions and purse strings, that's how this book ended up in the world. Otherwise, it was just getting rejected left, right, and center.
And who would you say is the primary audience for the book? You know, if you had to choose, who were you speaking to when you were writing the book?
I was writing this for us. Because I think we're amazing. I think sometimes we're fed up of the ways that we are portrayed, you know, to other people. But I made fun of us too in it, because it's not just the outside world that's cruel to us, it's each other. We police each other too. And, you know, we need to stop that. So I would say that's primarily the audience. But one of the nice things about having a young Latina editor was that she was like, oh, Seema, I don't understand this thing. Can you explain it a little bit more? And so I think the text is very accessible to people who do not have familiarity with Islam. And I think that's important, right? Because what are those stats about how few people actually have a Muslim friend or a Muslim person in their life? Those are the people that need to like read this, right? Because they're the ones perhaps that need the most exposure. But it is very much like by us, for us. In that, you know, like I said, it's very affirming when you open a book and there's a sister in there that reminds you of you, or reminds you of your cousin, or someone whose story you can relate to, even if she lives in the West Bank and you've not been there, like you're from Birmingham. But like the things that these women have gone through, the challenges, and yet the thing that unites all of them, whether they're a stand-up comedian or a scuba diving midwife or an astronaut, is that they've had so many challenges and they just keep going.
Yeah. And with the work that you're doing, you know, and kind of like trying to tie some of this together, how do you see Muslim women kind of in their portrayal, as well as how they show up, both in reference to the journalism that you do, as well as in the health field?
Yeah, so I think again, that's where anti-Blackness comes up too, because I think when a platform or an opportunity is given, the microphone is usually given to somebody like me, somebody who, you know, Islam is a religion, but it's a racialized religion. And there are some of us who look like what many people think a Muslim woman looks like, even if I don't wear hijab, right? I used to. But I still don't see enough representation of Black Muslim women. And not to say that Black Muslim women are not doing the work, they are, but the microphone needs to be handed over a lot more. And that's certainly true in journalism. It's certainly true in healthcare. I mean, I think it's just the same across so many different industries. And you know, during the end of the last panel, somebody was saying about challenging anti-Blackness amongst non-Black people of color, amongst our communities. Like that has to be a part of our practice of Islam. I've just heard so many times like, oh, I know I'm racist against Black people. It's how I was raised. And I know it's haram, but may Allah forgive me. I'm like, no, like every time we hear that, we have to challenge that. I don't think it's enough to say, I don't have the language to. You can learn. There are people who are doing the work and we need to learn from them.
And do you take some of what you wrote in the book and how you perceive the role of women, Muslim women? Does that show up in your work in terms of when you're on CNN or when you're writing your articles or when you are fulfilling a duty of care in your medical work?
I hope so, because I hope I'm not just doing performative allyship. I hope that I am embodying that. And that sometimes means saying no to some opportunities and saying, you need to talk to this sister instead. You need to talk to this person instead. I hope I am. But I think that's where community is important too, because you can feel like you're doing all the right things, but you have to have folks in your life who hold you accountable and say, hey, this thing you said was a little shady or a little problematic, or why did you take up all the oxygen in the room when you could have, passed the mic over to somebody else? So I would like to think that I challenge anti-Black racism, but I probably don't do it enough. And I also don't have enough of those difficult conversations with people in my family.
And then outside of your family, in terms of your ways in which you kind of challenge, I guess, maybe some of the disinformation as well as misinformation regarding Muslim women, are there ways in which you do that with your, if you, besides kind of like if you're going on CNN and they're asking for someone to talk and you're like, well, no, actually, I don't need to talk, you need to talk to that person. Are there other ways in which you, either you practice it or you see other people practice it? And also just really, I'm not sure in terms of like your practice of in hospital or seeing patients or working with your students, how does that show up in terms of how you mitigate some of these this disinformation and misinformation regarding Muslim women?
So I teach medical students and I teach faculty about advanced clinical communication skills. And that often means sharing some of my own experiences, because also if you haven't lived those experiences, I just see people get really shocked when I say, yes, I've had a patient say to me, they want a male doctor and they don't want me. or to make assumptions about my ability to understand English when they've seen my face but haven't even heard me talk yet. Those things are pervasive across society, and it turns out that, you know, a patient in pain and gasping for breath can still be very racist and sexist. Like, it's astonishing. And as a provider, you have to continue providing care. Of course you do, but it doesn't mean you don't take that hurt and that anger home with you afterwards. So I think the way that I do some of that work is by writing about it. I have a couple of essays for Medscape where I've written about what happens when patients discriminate against doctors of color, Muslim doctors. I also have an essay called How Medicine Perpetuates the Fallacy of Race, because I think one of the things that really frustrates me, Dr. Kabba, is we don't talk enough about race being a social construct. Race was invented, race is categories, it's classifications. They were invented in the 1700s by European scientists. And they made up these categories, and then the American Revolution happened. And those racial categories were very useful for Americans in justifying the enslavement of Black people, because they could say, but science shows that we are superior to Black people. Unfortunately, the way that race gets taught in medical school and across disciplines is as a biological construct. Race is not a biological trait. If you look at genetic studies, there is more genetic variation within racial groups than between racial groups. And people will often say, but sickle cell is a Black disease. No, it ain't. I've written about that too. I put on my Instagram about sickle cell disease is not a Black disease. Please, we have to educate ourselves about this. So race is a social construct, a very convenient one for white supremacy and upholding white supremacy, but racism is very, very real. That invention of race has impacted the health of Black people, especially, but also Indigenous people, other people of color. And so I just did, this time last week, I think it was, I did a clinical medical education, you know, those CME programs where doctors get accreditation for continuing education. I did that about a week ago to thousands of doctors talking about exactly this, that yes, Black Americans are 2 to 7 times more likely to die from COVID-19 than white Americans. It is not because of higher rates of smoking. It is not because of personal behavior. It's these systemic issues which over decades, over centuries have made Black people much more susceptible. And people complained after the talk.
Of course.
Oh, that I signed up for a clinical training. And I was thinking to myself, I made it very clinical. Because yes, I talked about the history of race science, but I also talked about genetics. I talked about how this manifests in the ER as the withholding of pain medicines from Black people. It was about Black women being ignored and dying at much higher rates in childbirth, but some doctors don't want to hear it. And that's how medicine continues to perpetuate white supremacy. And that's the agitation I hope I'm doing, and the provocation, and it might be uncomfortable. Sorry, you're gonna have to deal with it. We have to dismantle this.
Well, it's great to hear about the way in which you're weaving that into the classroom, and ensuring that, you know, we are kind of taking a very intersectional lens to all of these issues. I think that's kind of really part of that systems change that we need. I'm going to pause for a second and just ask if anyone has any questions to please do put them in the chat box. We have about 10 minutes left. Obviously, there's a lot more we can talk about. I'll wait for a few minutes to see if people do put in, but maybe in terms of thinking about final questions and kind of wrapping up, you know, it's very clear kind of the ways in which you are impacting the medical community, as well as, you know, journalism as well, kind of in that intersection. How do you see your work actually being taken on, or if you do at all, by the Muslim community? And what ways in which do you speak to the Muslim community? Not formally, like do you give lectures to the Muslim community, but, you know, do you feel that the work in which you do does speak to the Muslim community, and in what ways does that show up?
I hope so. That's a tough question to answer, because I think about impact a lot, especially with journalism. You know, we go into journalism, it sounds corny, but true, that you want to make a change. You want to give people information they can use to make better decisions, safer decisions, but it's hard to sometimes measure that impact. Sometimes, even though like what I do is very public facing, like teaching and doing CNN and doing journalism, sometimes what shows me that I make an impact sometimes is like one-on-one mentoring, to be honest. And I think definitely doing that for young women of color, young Muslim women, is very important to me. But I think it's really important that people like myself who have had privilege don't just oh, you know, I'm doing so much great work. Like, no, and you know, even those of us who are people of color, but we're not Black, we benefit from anti-Black racism. We get more opportunities because of it. We get paid more in publishing because of it. So we can't feel great about ourselves, unfortunately. Maybe for other things we can, but not for that, because that just has to be difficult, ongoing work until it ends.
Okay. And do you know, I guess, you know, the book is very, as you said, kind of like written by us, for us. Do you feel that that's kind of the core area of your work that really speaks to the community in that way?
I don't know, because maybe someone seeing me on CNN, that might be affirming. I don't know. I think
But that's very, I guess that's very kind of like unintentional in a way, right? Because you have that certain audience, rather than, you know, the book is very intentional, you know, in terms of like the background, the orientation, the choice of individuals and that messaging, and trying to make that as diverse as possible in terms of looking at the, you know, those individuals. But yeah, I was just curious as to see whether, you know, to know whether or not there are any intentional kind of actions that you see that allow you to kind of, you know, again, stay at that intersection in a way, but deal with the community.
I would like to say that I try and do everything with intention, because that's the way that I hold myself accountable. That, okay, I've been given a platform, that's lovely, but what am I going to do with it? And that means bringing up racism as a medical issue and a public health problem, even when producers, even when editors are like, no, we just want you to talk about public health, just like the symptoms of something, and it's like, no, you cannot unless we address, like, this is all part of the same problem. So I hope that I bring that intentionality. But like I said, people like me cannot be patting ourselves on the back. As much as I love awards and accolades, like my ego loves that. But no, like we just have to keep doing the work.
And with the book, what would you, have you, has your mother read the book, your aunties, what has been, you know, their reception in writing that?
My mum has read it, and the book is dedicated to her, so I know she appreciated that, or it made her cry. I think this book, you know, as much as I say it's written for us, by us, it's going to make some people uncomfortable. It's got Shias in it. It's got Ahmadis in it. It's got queer Muslim women in it. It's got Muslim women who are really provocative, talking about domestic violence as comedy, right? So there's going to be people that you read it. There's a transgender Muslim woman in here. My family are not going to like that. And I wrote this book knowing that, but you know what? Sorry, not sorry. This is the world we live in. These women are Muslim women. They face many of the challenges that we do, and they end up being shoved on the margins of the margins. Like, that is not how I am going to live my life as a Muslim. I want to, you know, bring us all together. So I have cousins who've read it and loved it, and others maybe who have or haven't read it, but haven't said anything.
And do you do a lot of kind of, you know, I know you tweet a lot, kind of both, again, kind of that transatlantic, you know, just what happened in Bristol today with the removal of the statue, and, you know, obviously, you know, focusing on the things that are happening in the US. And there is very much, you know, it seems that you do keep that kind of transatlantic focus.
I do.
That transatlantic focus kind of extend to kind of like, you know, that sort of not insular, but kind of the Muslim communities, or both kind of where you were raised as well as kind of where you live now. Does your lens extend there as well?
I hope so. To me, it's all so connected. And that's one of the beautiful things of being part of an ummah, is that no matter where you are, you find people that are part of your community. And the struggles are connected too. Like, seeing, in case anyone wasn't aware, earlier today in Bristol, protesters brought down the statue of a 17th century slave trader, Colston. And in fact, they shoved his statue into the same dock where he used to sail slave ships from. And of course, we've had people like Priti Patel say it was terrible vandalism. Like, forget that. Like, why hadn't Bristol City Council pulled down that statue already? But I have seen some Brits say things like, oh, it's so bad in America, it's so racist in America, it's not as bad. And I'm like, the brand of racism here came from Britain, like, and came from Europe. Where do you think these movements grew from? Nazism, you know, like, let's read some history. So yeah, it's connected, and there are nuances, and we need to do work on all continents.
Yeah, it's quite interesting actually to see that kind of portrayal, the imaginary of the average British person who feels that it is just happening in America. I recall just last week at a meeting at work, and someone said, "How are you?" And I said, I'd seen something on Twitter, and someone said, "Make this very commonplace." And I said, I'm very sad about the fact that the U.S. police state is killing Black people, and that the veiled violence of the U.S. state is also killing people of color and Black people. And my colleague didn't respond to the first part. I said, "What do you mean about the UK?" And wow. This is where we are.
How quickly we forget. How quickly. And it's very
Yeah.
convenient forgetting, very convenient erasure. I'm sorry you have to do that work.
Yes. Well, I don't do it. I don't do this work. I just say, okay, moving on. I don't have the energy to do these things. But yes, thank you so much.
Thank you,
Yasmin, for your time. It's like I said, the work that you're doing just sounds really fascinating, as well as really beneficial. I think what we are seeing now, that this intersection of the health pandemic as a racial pandemic, knowing full well that we understood what was happening from COVID, highlighting kind of the disparities in the Black community and people of color, particularly in the UK. We're seeing so much of it in the US. And
also, just really quickly, in India, it's become a whole an additional Islamophobic thing, with Muslims being blamed for the pandemic.
Yeah, this is happening in a few other places I've seen as well, in parts of Asia, China. It's
right.
likely in China. Yeah, so it's really interesting how I think why I was so interested in your work and wanting to speak to you about it is really because we see how powerful narratives are. And how, who controls the narrative and is allowed to shape the way in which that kind of flows through communities and society. And then we see the outcome of that. So in the US, obviously, we've seen, and in the UK, where people are actually afraid of Asians and, didn't want to go close to them when Corona first started. And then you saw in places in China where people were blaming Black people and not allowing them to shops and saying that they were the ones that were carrying the virus. So it's very interesting how all of this is kind of shaping Corona Jihad, to see. Okay, thank you, Zainab.
Yeah, that's a report that came out from Equality Labs, and I actually just gave them an endorsement. So it's definitely it's about misinformation and disinformation, and also very targeted Islamophobia, using the pandemic as a weapon against Muslims.
Right. And a lot of Zahid's work, obviously, is very much kind of like on target with.
We work with Equality Labs, and we've just published a report on Corona Jihad as well. But it's anyway long. There's so much, we could have a whole webinar on that. Maybe.
Yeah, we should think about having that.
We should actually. But I will just say that as challenging and as disturbing and sad some of the things we've talked about, I do have a very big belief and a lot of faith in the idea that books can change the world. The narratives and stories, they expand our minds, they make us uncomfortable, but they entertain us. And that's how our perspectives are broadened. Even one of my publishers, he's a white Jewish man. He's like, "Oh my God, everything is so terrible. I don't feel like I'm doing enough." And I'm like, keep publishing books by people of color, keep publishing books by Black people and Muslim people, because these things, they're not trivial. People read these things and they see us, and they see us differently.
They do. Yeah. Well, thank you so much, Yasmin. I know we're just finishing off. Thank you so much. Wishing you success with the debut of the book. And yes, good luck with all the work you're continuing to do. And thank you for just being there, being on the front line doing that work. Thank you.
Thank you. Thanks for all that you do, and thank you for making time today.
No problem. All right, Madame, I'll turn it over to you.
Yep.
Sorry, guys.
I forgot now.
No, I just want to thank Dr. Yasmin and Dr. Kabba as well for a great discussion. Again, the book Muslim Women Are Everything is out now in the US. It's out in 2 days in the UK. I put a link up in the chat room. I'm going to, over to Mudassir now for the next session.